It's called Post-Vaccine Considerations for Healthcare Personnel. And so I want to be sure that any healthcare personnel who are listening, I'm assuming already know about this, but if they don't, it's a very important notice that you need to take into consideration. And basically, it's pretty long, but essentially what it does is it goes through an analysis of post-vaccination symptoms. So that, in other words, people who have the vaccination sometimes develop symptoms because of it. Sort of like when kids get flu shots, sometimes, you know, they show symptoms of the flu just from having the shot. And apparently that can potentially happen from the vaccination as well. And so it gives, again, this is from the CDC, the federal CDC, and it gives some guidelines about how to give the vaccination in a time frame that limits any potential concern about post-vaccination symptoms. Because of course the concern is if the symptoms are the same as they were for COVID to begin with, then you don't know, is the person now positive even though they've had the vaccine, or do they have a different strain that's just come out, or what do these symptoms mean? So they offer some suggestions, which probably are just as useful to non-healthcare workers, I mean, in any work environment. And they make sense. Things like, for instance, having the vaccination immediately before a person is set to be off for 1 to 2 days. So maybe you do them on Friday so that they have the weekend to recover, and that way you have a better idea. If they show symptoms still by Monday, then maybe it's something more than just a result of having had the vaccination. And then, for instance, they recommend staggering delivery of the vaccine by department so that you don't have an entire department of people out at the same exact time if they were to develop these symptoms as a result of having the vaccine. So it's an interesting document for everybody, but of course, especially important for healthcare personnel. And again, that's on the CDC website.
Yeah, that's interesting. We have some clarification back to the question about schools, and we've touched on this, but essentially, in order to enroll in some schools, parents must show proof of vaccines. Schools are allowed to require certain vaccines, so should employers have the same ability? Obviously with exceptions within reason. But it gets back to that question, that the conversation we've been having about, can employers require vaccinations?
Yeah, and you know, the short answer is the EEOC says you can as of now. And then of course there's the 50 million things that go along with that.
And what about if somebody does in fact have a reaction to a vaccination, and let's say you as an employer require them to get the vaccination, would that be considered workers' comp in any way, shape, or form?
Yeah, I think there's a good chance that it would. And the guidance that we have to figure that out comes from the flu vaccinations, because there have been cases, in fact, I've had cases before the board about bad results from flu vaccinations that employers have required or encouraged their employees to have. And under workers' comp, the rule seems to be pretty clear that if you either require your employees to have it, or you can be said to have strongly encouraged them to have it to the point where they feel like they really can't say no, then the consequences that flow from that vaccine, you most likely are going to be responsible for under workers' comp. And that could include an allergic reaction, for instance, or just as an example, I had a case where the vaccine was improperly given. And so the person developed a very serious medical problem from having had the vaccine improperly given, and that was determined to be work-related. So that, yeah, that's a major consideration and a potential pretty big downside to an employer requiring the person to have a vaccination. And it's certainly something that employers need to think through and maybe talk to their comp carriers about ahead of time.